Welcome, hospice clinicians. This recording will introduce you to the new Hospice Clinician Note, which is coming to your Cerner software the week of August 15th. As all the existing workflows are rebuilt to include this new note, it will replace the existing routine note for nurses, the psychosocial notes being used by social work, and the chaplain note for chaplains. It's also meant to be used for documenting the death visit. This does not mean that social work will not be able to access your special assessment tools. Those will still be available to add to your visit as needed, but this will replace your routine note. Once the new note or profile is in use, it will then appear down here in your In Progress Profiles box, awaiting completion and locking, and the description will now read Hospice Clinician Note, rather than the current description showing in your box as your psychosocial note or your chaplain note. I'm going to go ahead and click into the Hospice Clinician Note for our patient Tinkerbell, and we'll take a look. This new note is designed to be used by all of the hospice core disciplines, and it contains some new sections, one for advanced care planning here, where all of our advanced directive information can be gathered. Down a little further, there's a psychosocial and spiritual section that has been developed for use by social work, chaplain, and nursing as needed. And they've also added at the very end an end-of-life care section, which allows us to document what those things that go on during the death visit and or with postmortem cares. So we'll start with this note by looking at it from the beginning, and notice that the very first section, this should be familiar with whatever note you've been using. They have the plan for this visit. This section is unchanged. This will be blank on admission, and then on subsequent visits it will pull forward the plan for next visit created by the last clinician to see the patient. So if there's a particular issue concerning the patient and we want to make sure that whoever visits the patient next readdresses or does follow-up, we can put that in that plan for next visit, and I come in as my routine visit, and there will be sitting, that information will be found in this box to alert me to those concerns as I prepare to begin my visit. The next section in this note is identifying how we're recognizing or identifying the accurate patient. On our very first visit, we may be going by the address. Once we have that relationship and we know who the patient is, there's a prior relationship or facial recognition here that we can use. The primary reason for the visit, you will simply indicate if you're there for your comprehensive assessment. That's your admission visit. You can mark that. A routine visit, if you come in due to a symptom issue, a symptom management or a PRN visit would be here. And as social work and chaplain, you will not be addressing recertification. And this particular recording is going to be focused specifically on social work and chaplain use of the Hospice Clinician Note. There is next a section on home environment, and this is where a whole variety of home and safety concerns can be addressed, identified, and further explained in the narrative section. Also, any safety or sanitation hazards that may come up during your visit. This gives you a place to identify those and then address them in detail in your narrative box. There is a brief abuse or neglect assessment, which may come into play as social work may perhaps investigates concerns of abuse or neglect. We do, on admission, want to make sure that our patients know how and when to contact the agency. We're certainly not encouraging the 911 or them calling the physician directly, but we would very much want them to know that how and to contact us when there's a concern. Then there's a other community support services section, which I think will come into play for social work as you work on setting up community resources for your patient, and a narrative field to do your narration on those topics. The next section, and as we come here, let me just point out, and this has certainly been true in the notes you've used previously, there's this little box on the left upper hand corner that you can go actually from section to section, or directly to the sections that concern you or you on a chart by clicking on the section. That saves you having to scroll through the big long list if there's other things that you may not be using on a given day. So our next section is a new section that was developed for this note, and this information was a little bit hard to find and chart to previously. This is our advanced care planning section. As you come in on a regular visit, you may find in this top box anything already added to the chart as being part of that patient's advanced care planning. You then have access to educational documents throughout. For example, this one on advanced directives, if we click on the blue hyperlink, takes us to some information to help teach us about advanced care planning. We also have a hyperlink here to preferences for life-sustaining treatment, which takes us right into our HIS manual explaining section F, which is the preferences addressed in advanced care planning. If you need additional information, those are available. Another feature in this note is that as we click into various fields, additional fields open up. So for example, if you were to identify with this patient that a financial durable power of attorney is available, it's now going to say, did we get a copy or did we make a request for a copy for our charts? If we're requesting a copy, then we're able to come in and put the individual that we've requested the copy be made to, and you can type in their name. You also have the ability to identify when they have a post or a post. And again, did we get a copy? Did we request a copy? If they have some type of unique advance directive, you do have an other category that allows you to free text in the name of that document and whether or not we got a copy or requested a copy. As you know, just identifying end-of-life documents is not a sufficient way of addressing what patient preferences are. This section has inside of it the very specific HIS questions regarding CPR, life-sustaining treatment, and hospitalizations. You do have the opportunity to actually answer the question, no, it didn't occur, we didn't ask about it, or yes, we did and we talked about it, or no, we didn't. However, a checkbox is not evidence that a discussion occurred. So you'll still need, once you've answered the questions, you've got your narrative field at the end of the section where you can state patient requests to remain DNR, does not want to be rehospitalized for any reason. And you can put that evidence of discussion in the narration. So here's the HIS questions. You're going to answer those appropriately regarding end-of-life requests. Notice too, as we come in here on end-of-life treatments, if they have a specific request, you click in here and then you're able to answer more specifically. Yes, no, or not applicable. The hospitalization preference question is here as well, and then you have opportunity in the narrative space to confirm your discussion. Patient states, and actually our patient is a she, I should get that right. And you can continue to put the evidence, what you talked about in your discussion, in that narrative field. The next section is the vital signs section, and this is where the clinicians, the nursing clinicians, will be entering in vital signs. You'll have access to see some of that information, the most recent entries, and also in the comparative box here, but will most likely not be using that section. The cardiopulmonary section is where they will be doing their assessment details for shortness of breath and any kind of cardiopulmonary symptoms and assessment details. If they click on details in all of these physical assessment sections, they can click on assessment details and it opens up the place to put that information. As a social worker and chaplain, these are sections you may go to view information, but you will not, most likely not be charting in these areas. So your guideline to this document shows that you can skip this section. The next section you will want to use, however, is the care plan section. This appeared in your current notes as well, and it functions exactly the same. And this is where on any routine visit, once you've built your care plans, you have the opportunity to select an active problem. And look, luckily we have one here that's appropriate. You can bring in the goal from that problem and add that to your note. If you'd like to then go in and talk a little bit about that, you can type in additional information here about that goal. You can bring in the specific intervention that you talked about or performed that day, and you can then come in if you'd like and address in that space the patient, there we go, patient response to the intervention. Okay, and you can type that in, and you can hopefully spell. Luckily, these narrative spaces do have spell check, for which we're very grateful. You also have an opportunity to indicate if you did make adjustments to the care plan on this visit, and or if the family participated. You may recall from using your existing notes and in your existing workflows, which is our list of tasks to do to complete a particular type of visit, that you have an opportunity always to review the care plans or review the orders the patient has, to go in and do your assessment, then go back and add to or indicate completion of your care plan goals and interventions. Then we go back to the note as an update, and this is the section where you would do that update. You would now pull in those new interventions that you've added to the care plan, and you can address them specifically here. You always have this narrative space at the bottom to address any of those issues from the care plan, the goals or the interventions that you've been working on, and any progress towards completion of those goals. This patient history and diagnosis section is really geared for home care, talking a lot about hospitalizations. Our nurse clinicians are going to be doing their eligibility statement still on the LCD document, and you most likely will not be using. This will be a section that you will see the word skip by. You're able then to skip the medications. If you do want to view the medications a patient is on, you certainly can click in and view that. The next section that may come into play in your documentation under neurological and behavioral, this is where the social workers can address cognitive status, and you would then open up assessment details. It would bring open the additional spaces for orientation. You can access a portable mental status tool by checking there. It will open up that tool for you where you can complete it. Indicate any neurologic issues if they're there. Here's your behavioral status here. And again, as you have access to another tool, the brief behavioral health screening tool, and a narrative space. So that area may be helpful to use for your cognitive assessments. Then we come to our psychosocial and spiritual section, which was a newly added section to this note. And this is where we then are able to click in on the psychosocial area, and it's going to open up the psychosocial assessment items. Okay, so in this section, this is where our social work will be addressing mood, mental status exam, suicidal ideation, substance abuse, and coping as appropriate. And you can see all of these different tools here. Okay, it's also where, and notice I should just show you, if I click on one, it's going to open the tool up. This is where you'll find your bereavement risk assessment, and this would be the case for both chaplain and social work. If you're completing a bereavement risk assessment, you would open that up. It gives you an opportunity now to answer those questions and complete that as a bereavement assessment as appropriate. You also, here's where, remember up there we clicked on psychosocial, now we can click on spiritual and existential. It does give us a link into the HIS manual for an explanation of this particular item on the HIS. If you have specific questions there, and an opportunity to say yes, a discussion occurred, yes, but they refused, or no, it did not. Once more, just saying yes and no is not evidence of a discussion. So you would come down into the narrative box and put what something to evidence, to show evidence that you had that discussion. And this is not an identification of religion. This is simply any concerns they may have of a spiritual nature. You also have an opportunity, and I know in your current note for social work, they basically have this narrative space for their visit summary. And they've built in here, in addition to this big care plan section that everyone can use, they built in a care plan section for psychosocial and spiritual, and you can actually come in through here and access your spiritual and psychosocial goals and interventions. So you're able to pull those in, and then it'll put that into your narrative space, and you can address that right there in that care plan section inside your psychosocial and spiritual section, which is very nice. Okay, we have some additional fields for education, things that we're teaching the family, and if they're able to participate with us in our teaching, and our overall narrative space for the psychosocial and spiritual supporting documentation field. On both the the social work and chaplain guides, there are a number of sections you're going to be able to skip. So sensory status and EENT is one of those you will most likely not be using. And there are several other physical body systems that you'll be skipping, but the comfort and pain section you will not skip. This is the one mandatory answer that you must answer on every patient, and this is similar to what we were doing in our previous electronic medical record, where every clinician to enter the home makes sure the patient is comfortable. And if we see that the patient is not, and they're voicing or it's evident that they're in pain, we have an opportunity to then notify our case manager, get our family in touch with the nurse, get some instruction, direction, and get that pain addressed. It will be a much more beneficial visit for the patient and the clinician if the patient's pain is well managed. So you would simply answer if they were screened for pain. If you mark no, that's the end of that. If you mark yes, you're going to go ahead and put the date of your visit in there. And then you can put if they give you a score during your visit, this is the highest pain severity identified during your visit. And what you would most likely do, you won't be doing a comprehensive pain assessment, which is what this box here does, but you could then come down to the narrative and say, reported patient complaints of pain to case manager, or whatever happens, or reported patient's concerns, notified case manager, so on. You just however you addressed that issue, you've got a narrative space, but you want to make sure you're checking and screening for pain, and that will be a mandatory field that's going to then show up here in the in progress for mandatory fields. There are some other mandatory fields inside of sections. Once you answer a certain way, then giving additional information about that field becomes mandatory. But outright, you definitely have to answer the pain question. Okay, our next section, GIGU, our nutrition and endocrine, infusion therapy labs, you're going to be able to just skip. Let me bring this up on the side, and you can see you'll be able to just skip through all of these fields. Okay, and on your guide, you can see that you basically are able now to skip clear down to the summary. Okay, so I'm just going to scroll down. You can see these fields open up into huge, assessment pages for the physical symptoms and things that the nurse will be dealing with. But you're able to scroll all the way down, or better yet, just come over here, scrolling down through the chart to the summary. The summary is just what it says. It's simply a narrative space for you to summarize your visit. So you would click add. You can tell what kind of visit you're here doing. And then go into your narrative box, and you can type out the note that you would generally summarize your visit with. There is one additional new section added here. These last two sections that may be of use to you, and that would be on end of life care. If you were present during the time that a patient was passing, you could come in here and use, if you were involved in notifying the family or notifying other people involved in the patient's care, you could come into this narrative space and put that in. There are certain questions here. Any care coordination, you can add that field and indicate if maybe you helped notify, and the nurse is working on one piece, you helped notify some of those other individuals or called the funeral home. So you would find space for that type of charting here, as well as a narrative space at the end to summarize that visit. There is a section on postmortem care as well that is available, and an opportunity to document any teaching that was done about drug disposal. So again, the narrative space would be good. And when we talk about attending a death or being present for a death, and we know very importantly that right now visits from the social worker during the last 7 days of life are very important and are being paid with the SIA add-on at a continuous home care rate. So any visits you do during that last week of a patient's life, we get an additional about $36 an hour for your time spent with the patient. Very important. And coming up, starting in 2017, there'll be changes to the HIS that are going to show, one of those things they're going to start measuring is how many visits a patient received during their last week of life. So please keep that in mind and know that this is an area where this would be the note you would use, and you would use this this section at the end of life care. The plan for next visit section, which is what we come to next, is the same as your current notes. This is an opportunity for you to leave a message for whoever's coming in to see the patient next, to be aware of specific needs or concerns for follow-up that you would want them to check in on as a result of your visit this day. All right, that should do it. And again, you've got your guidelines to follow. If you have any specific questions or concerns, you could get a hold, or you can call the extension 4119. That's 801-397-4119 for additional direction. Andrea was involved in helping set up these guidelines for social work, and we'll make sure that Joyce is also available to help with any questions from the chaplains. Remember, once more, you can still add on your special assessment tools. They are available. We add new document to your visit, and you can bring in those additional tools as needed. Thank you.